The information and opinions expressed in this podcast do not necessarily reflect those of ASRM and its affiliates. These podcasts are provided as a source of general information and are not a substitute for consultation with a physician.
I'm Jeffrey Hayes, and today on the show we get the latest on the most recent ASRM COVID-19 Task Force update from Task Force member Dr. Jennifer Kawwass.
Welcome to ASRM Today, a podcast that takes a deeper dive into the current topics in reproductive medicine.
Dr. Kawwass, thank you so much for being able to join us on ASRM Today. If you would, could you just briefly explain to the audience what your role with the task force is?
Good morning, Jeff. Thanks so much for having me. I have been a member of the task force since it began in early March, as we were realizing that the novel coronavirus pandemic was going to affect those of us in the United States and not just other parts of the world. Been meeting regularly, initially at 2-week intervals and now about every month, to evaluate and provide updates about the current landscape, thinking locally, nationally, and internationally.
You touched on that the task force, some of the goals is to evaluate the current landscape and to provide updates. Are there any other goals that the task force has every month now as they gather to put these things together?
Thanks, Jeff. Great question. So yes, in addition to thinking through the current landscape, task force aims to answer questions that might pertain to fertility providers and patients. These may be questions that have been brought up since the past update, or they may be considerations that we think may be relevant in the future, and sort of trying to plan ahead and think ahead as we're learning more and more and everything is evolving really on a daily basis. We also aim to come up with concrete suggestions to optimize patient care and safety, and also patient and provider counseling. And I'd say we try very hard to make our evidence-based on science and to provide sort of the scientific evidence that supports the recommendations.
Based on what the task force is seeing, what is the current landscape?
At the time of this current publication, the U.S. unfortunately is still leading in the number of deaths and also in the number of cases per capita. At the time of publication, we were over 6 million reported COVID-19 cases and over 185,000 deaths related to the novel coronavirus in the United States. We've also noticed that the virus seems to be disproportionately impacting individuals of African American and Latino racial ethnicities. There is some good news. We have noticed a 40% decrease in the 7-day average of new cases since the beginning of August. The caveat, however, is that there is tremendous variation in different parts of the country. While the areas like the Northeast are showing fewer and fewer cases per day, there are other portions of the country where actually the prevalence and incidence are both increasing.
Has there been any sort of widespread misinformation?
Unfortunately, we're living in an era where a lot of things have been politicized. There's a lot of available information, but it's hard to differentiate that which is based on science and fact and that which may be anecdotal. This is all compounded by the fact that this is a new virus. And so the science even is changing on a daily basis. So it can be really tricky to sort of keep up with what is accurate, what is not accurate, what's true today may not have been true in the past or true in the future. So I think it's a tricky field to navigate for patients and clinicians.
And I'll take this opportunity just to remind our clinicians also that they can go to www.asrm.org to get all the current updates on COVID-19 that the task force is working on, but also just other fantastic resources during this time. Dr. Kawwass, what are the current recommendations being made by the task force?
Yeah, so update number 8, I'd say, is fairly brief compared to some of the prior ones. The first recommendation is just that the task force continues to endorse and support the measured delivery of fertility care with strict adherence to the recommended measures for disease prevention. So it's sort of an affirmation of the prior updates that said it's reasonable to resume and continue to provide care. The current update also touches on the concept that we penned, think ahead, have a plan. As we know, The pandemic has been somewhat unpredictable, and there is a recommendation in this update to sort of anticipate a potential resurgence that could occur this fall concurrent with the flu season. And the task force is encouraging providers to come up with a backup plan that might involve forming alliances or arrangements with other local providers that can help them maintain clinical and laboratory essential services for patients if they were to find themselves in a situation in which clinic team members became infected or could not provide care. And the final two portions of the update focus on proactively and deliberately addressing misinformation. And this addresses the fact that there's a lot of overwhelming and contradictory information that can be difficult to synthesize, and suggests that it's very reasonable to direct patients towards sources of reliable information, such as the CDC website or the ASRM website. And finally, there's a recommendation to get the flu vaccine for providers and patients alike.
The updates have gone to monthly, so we won't see another update again until around October the 5th, unless the conditions warrant an earlier release. What do you believe the next update will be likely to touch on?
Great question, Jeff. I think the next update will likely touch on some topics that have a great deal of nuance associated with them. These are things like testing, therapeutics, mental health concerns related to patients, and then forthcoming COVID vaccines. These are topics for which the data has potential, again, to be sort of confusing, and the task force will aim to sort of review everything that has been published up until that point and try to come up with some streamlined, concise summary points that could be used by patients and providers regarding those topics.
Dr. Kawwass, thank you so much for being able to take time out to provide us with a quick update. And thank you for all of your work on the task force.
Thank you. It's been a pleasure to be a part of the team. And we're hoping to reach a point where we don't need monthly coronavirus pandemic updates.
Absolutely. Thank you.
Thank you.
That was Dr. Jennifer Kawwass, Medical Director of the Emory Reproductive Center and member of the ASRM COVID-19 Task Force. I'm Jeffrey Hayes, and this is ASRM Today.
This concludes this episode of ASRM Today. For show notes, other information, and discussions, go to asrmtoday.org. This material is copyrighted by the American Society for Reproductive Medicine and may not be reproduced or used without express consent from ASRM.